As we etch this Decode talker, I thought we could talk about decoding a malfunctioning brain, specifically mine. I've been debating whether to do a video about this. Honestly, I'm not sure if there are people out there who would be interested in hearing about it, but the couple times I've mentioned migraine struggles in my Instagram stories, I've always gotten replies from others who also struggle, so I thought I'd share my story with you. Partly to share more about me, but also to give others who might find themselves on this path insights about treatment options that they haven't tried yet. If you or someone you care about struggles with migraine, maybe my experience can help you with yours. If you get squeamish about medical stuff, this might not be the voiceover for you, as a heads up. Feel free to mute me. I'll start with my history of migraine, the treatment options I've tried up to this point, my specific symptoms, which do vary from person to person, triggers I'm aware of now, and how it has impacted my quality of life over the last few years, including my ability to enjoy Yu-Gi-Oh, unfortunately. I'll close with suggestions on things to try or talk with your doctor about if you or your loved one also struggles with migraine. There will be chapter notes in the video description if you want to jump to anything. Let me start by saying I've struggled with headaches since basically puberty, and a headache is not the same as a migraine. My recent struggles with migraine started in October of 2020, where I had a migraine that lasted a solid consecutive 16 days. I finally caved and went to my doctor about it, and a chronic diagnosis shortly followed. Those first few months, I tried treatment options that had helped with headaches in the past. Consistent chiropractic and massage visits, not cheap, cutting corn from my diet, and general efforts at stress management. When that yielded no changes and I was still having 11 to 20 migraine days a month, despite my stomach twisting fear of needles, I decided to try acupuncture. Short version, it also didn't help. Gosh, I hate needles. I started working with my primary care doctor during this time, who put me on different prescriptions that have been known to help with migraine management, as well as a range of tests to rule out potential causes. Unfortunately, it wasn't that I just wasn't drinking enough water. The tests included blood work, a very thorough environmental allergy test that involved even more needles, blood work testing against different potential food triggers that also involved more needles, and an MRI to rule out a brain tumor, which was thankfully not the case. Everything came back clean except for some of the potential food and environmental triggers. So I spent a significant chunk of 2021 doing an elimination food diet to test if the foods that showed a reaction in the blood work would affect my migraines if I cut them out. Sadly, this also yielded no results. My first couple prescriptions showed no change, and the final one I tried with my primary care doctor was one that, I found out later, was normally used to treat people with depression and anxiety. I don't struggle with those things, thankfully, but that drug screwed me up. I started taking it a few days before an out-of-state trip with my now husband to a friend's wedding. During the trip, I started to lose gaps in my memory. By the end of the long weekend, I was forgetting the names of the bride and groom, and by the time we left, I even forgot my partner's name a few times. It was terrifying. I was struggling to get a hold of my doctor to ask what I needed to do. I had read online that going cold turkey off this drug could cause strokes, and thankfully it was able to get input from a family member who is a nurse practitioner on how to safely wean off the medication until I finally heard from my doctor, which took nearly a week after the memory gaps started. Honestly, it was one of the scariest things I've ever gone through, losing my ability to think like that. I had a meeting at work I'd scheduled and barely kept from crying through it. I was so scared because even though I'd organized the meeting, I couldn't remember why I'd organized it and completely winged it based on notes I'd left myself before the symptoms started. It was like trying to run it off someone else's notes. And through all of this, I was still fighting migraines too. I finally heard back from my primary care doctor, and after that awful experience, I finally got referred to a migraine specialist. It took a while to be able to get on her rotation, but I've been working with her now for the last 3 years. If you suffer from migraine, I highly recommend you advocate for yourself and push to get referred to a specialist. Having a primary care doctor is important, but they are likely not as up on the current treatment options as a specialist would be, and migraine is a fast-evolving field with new studies and treatment options coming out every year. Some of the medications I'm on now that help didn't exist when my journey started. With my migraine specialist, I tried a few different preventative medications made specifically for migraine, some pills, some injections. None of the injections worked, which I guess on a positive note meant not having to live the rest of my life with monthly shots, but also still meant living with chronic migraine. By 2022, I was having daily migraine. I honestly still don't know how I survived that year. Prayers alone, really. I finally got on a new preventative called Qulipta in December of 2022, and it almost instantly knocked me from daily migraine back down to around 15 migraine days a month, which is roughly the range I've been in since, and managed based on the symptoms I'm dealing with each day. My symptoms have varied over the last few years, especially based on what's triggering them. My main triggers are weather shifts, light sensitivity, and hormone changes. Sometimes I'll wake up and it feels like someone shoved a railroad tie through the base of my skull. I don't know what triggers those, but thankfully they have been less common since getting on Qulipta, which has been a relief, as those consumed the majority of my PTO days in 2022. Normally, my migraines these days either start at the top right side of my head or base of my skull from weather pressure shifts, often days before a storm arrives, meaning spring and fall are the worst times of year for me, or they start as a building pressure behind my eyes, triggered mostly by fluorescent lighting, and sometimes by prolonged exposure to blue light. On a rare occasion, it will be from muscle tension, and a chiropractic adjustment and massage can do a lot to help with those, but these I have found to be the easiest to control and prevent, thankfully. If you struggle with light-triggered migraines, I highly recommend you look into green light therapy. My 9-to-5 job is in a corporate office, complete with fluorescent lighting, and normally within minutes of being in the building, even if I felt perfectly fine before work, a migraine will start. It begins by feeling like someone is trying to push my eyes out from within my skull through gradually increasing pressure, and a headache steadily grows the longer I'm exposed, normally more concentrated on the right side of my brain. Directly looking at a fluorescent light on accident can escalate it to almost instant nausea. It's crazy how it feels like there's a direct pathway from my eyeballs to my gut. Every weekday, I get up knowing I'm going to a physical location that will trigger this in me outside my control, and it sucks as the symptoms stack throughout the day. I'm fortunate in that I don't experience aura or loss of vision during my migraines like some do, but I do deal with headache, neck and shoulder pain, sometimes so tight it's hard to turn my head, nausea, light sensitivity that starts as dull pressure but gradually increases to striking pain if I'm unable to address it, difficulty speaking or formulating words, and for very severe ones, vomiting and sound sensitivity. I try to manage these through my migraine toolkit, which includes a mix of prescriptions and non-drug aids. If I'm unable to manage it in time, the result is me needing to lay down, head pounding, and unable to function, while trying not to throw up everything in me. At the time of recording this voiceover, I'm on 5 prescription medications to manage my migraines. Qulipta is the one I couldn't afford without insurance, and I take it nightly as a preventative. It's the one that cut my migraine days in nearly half at the end of 22, and seems to have mostly stopped the migraines where I wake up feeling like my head is on a spike. So grateful those are rare now. 2 of the meds are abortive drugs that are supposed to stop a migraine attack after it starts, Nurtec and sumatriptan. I've also been on rizatriptan in the past. I have fewer side effects with the sumatriptan, but it still kind of sucks. The sumatriptan is a 50-50 success rate for me. It's a little bit of a gamble on whether it's worth taking it or not, because sometimes the side effects are as bad as a migraine. If I can take it right at the onset of a migraine symptoms, when I can feel the pressure beginning, but before it erupts into a full headache, then the sumatriptan can hijack whatever's going on in my brain and stop the onset. Normally this means about a 2-hour window where I'm not quite a vegetable. I try to time it with my lunch breaks when I have an attack at work, but ideally, I would be able to go lay down in a dark room until the medicine has had a chance to work. Very rarely, this means minimal discomfort and a normal rest of my day, but few of those have happened. More often, the sumatriptan makes my brain feel like someone's trying to wring it out like a wet cloth, then wrapping it in a wet towel and trying to smother it. Normally, after it has taken effect, the headache, pain, and often the nausea are suppressed by the sumatriptan, which is good, but I'm left with lightheadedness, brain fog, and sometimes a general sense that nothing's quite real. Not ideal, especially when these hit in the middle of the workday and you're trying to push through and be professional and whatnot. The Nurtec is infinitely better, and I have no side effects from it, at least that I've noticed so far. And sometimes it just takes the migraine and makes it dissipate, but sometimes it does nothing at all. I found that if I take a Nurtec at the very start of a day, when the first flickers of pressure begin to flirt with the back of my eyeballs or the base of my skull, then the Nurtec can prevent the rest of the day from going downhill. So often it just comes to being able to read my body, knowing when to take which drugs. On that note, unfortunately, insurance only approves so many of the sumatriptan and Nurtec a month, and between them, I rarely have enough of them combined to combat every migraine I have in a given month, which means a lot of picking my battles to decide which migraines I want to use the meds on versus which I just try and push through because I know I'll need the prescriptions for later days in the month that I don't want to risk missing, like for important work meetings or fun plans in my personal life, which I don't want to sacrifice to a migraine. On days I suffer through, the last 2 prescriptions come into play, as they're both for pain management. The limited resource of the abortive drugs is also why the non-prescription items are so important. Through my own research, I've learned about Avolux glasses and green light therapy, and I honestly don't know how I'd still have a job without my Avolux glasses. They aren't always enough to stop a migraine, but they definitely help delay the onset and intensity. I use an LA green light lamp at home at night, which soothes the pressure built up from fluorescent light throughout the day. I also couldn't go without what I call my zappy stick, aka my AccuPen, which is something I discovered after trying acupuncture. It's essentially a portable pen-like device that delivers an electric shock to a specific point, similar to the stimulation a nerve would get through acupuncture, but without the needles. I carry mine with me everywhere, and it has helped fight off many migraines, especially light-triggered ones, by electronically massaging the pressure points around my eyes. I haven't found a good solution for weather-triggered migraines yet. These normally start as a sharper pain at the top of my head and slowly sinks into a pounding headache, nausea, and if I'm unable to take my abortive drugs in time, often vomiting and being a sack of meat in bed the rest of the day. These can come on much more suddenly than the light-triggered migraines, although that being said, if I don't have my Avolux glasses or other toolkit drugs with me, the light-triggered migraines can also easily devolve into a lost day or evening holed up in a dark room with a trash can and my head wrapped in ice packs. If a migraine gets to that point where I need to lay down, one of my favorite non-drug tools I've found is my Cefaly device. It's essentially a TENS machine for your head that helps soothe the nerves in your forehead like an electronic massage for your brain. I love it. Normally, laying down in a dark room with a Cefaly, ice, and a proper cocktail of drugs for an hour can reset my migraine and rescue the rest of the day, or at least get me mostly functional again. The only real downside I found with it is that you do need to be mostly horizontal, or at least my oily-prone skin does, because the electrodes that secure the device to your forehead will peel off if you're upright. There's a similar device called a Relivion that can be worn upright, as it fully wraps around your head instead of just sticking to the forehead. It uses little sponges you soak with water instead of gel electrodes, and it's bulkier than the Cefaly, but generally more portable because it's easier to wear out and about. Explaining it to coworkers is a little awkward, but it's worth it. This year, my specialist has started me on Botox for migraine treatments. Explaining that one to my dad has been awkward. I've only had about 2 treatments so far, with no noticeable results from the first and the second only about a couple weeks ago at the time of recording, so the jury's still out on if this is going to help my situation. I do know that it has been a game changer for others, so I'm hopeful for results. But the 31 injections every 3 months is daunting, and it's not even in locations that help me keep from aging, so have I mentioned my needle phobia? I have been put through the ringer this last 5 years with the needles, I tell ya. Every time I need to go anywhere, I have to lug around my migraine toolkit in case I have an attack while out and about. It makes mobility and travel generally more challenging, even for what used to be minor things like going to weekly locals. I love my locals, and we have some great people who play regularly that I always look forward to seeing, but it's about a half-hour drive to get there from home, and by 5 p.m. on Fridays most weeks, I'm tapped out. It's rare I get past 2 p.m. without a migraine already started most days, and the dice roll on the abortive drugs doesn't always land in my favor, so even when I am able to take them, sometimes they hinder as much as they help. I've definitely gone and pushed through several times, but feel super self-conscious about being an annoying opponent if my brain is lagging too much for the duel to be mutually enjoyable. It's kind of hard to communicate when you can barely form words. I'm grateful for the folks at locals who have been patient with me through those duels, though. Again, blessed to have great people there. I got to play in my first regional in years in March of 2024, and while the event as a whole was fun, and I'm glad I went, after 5 rounds, not doing too bad honestly, my head was pounding though, and my stomach was churning, and I didn't want to throw up on my opponent's cards, so I had to drop. It was about a 3-hour drive to the regional, and my husband had also gone, so thankfully I wasn't stranded, but I'm like painfully aware that I would have been had he not gone with me. I still haven't given up on being a duelist, but fighting this disease that makes it physically challenging to go to events has been a struggle, on both physical and emotional levels. I'm not ready to let the dream die. I'm hopeful my doctor and I will find a solution, or Lord willing, I have a miraculous healing and I'm freed from this burden, but until then, I'm looking for solutions. I hope sharing my experience so far was helpful to you. Thank you for listening to the end of the video. If you learned anything from this, I would love to hear your takeaways in the comments. I'm also curious for fellow sufferers if you had similar experiences in your migraine journey, or if you found other options for relief. I think migraine is often a misunderstood disease that many will brush off as just a headache, but it's not. For some, it's a full-on disability that robs people of their ability to live life. But that doesn't mean we stop trying. If you made it to this part of the video, leave a brain emoji in the comments. I appreciate you. And with that, friends, happy arting and happy dueling. Bye, guys!